How crucial do you reckon the pre-hospital management of obstetric emergencies is? Let's dive into that today. To begin, let's consider a scenario. A woman in her late pregnancy stage experiences a sudden medical emergency. It could be severe vaginal bleeding, early onset labor, or severe abdominal pain. The minutes following this could be critical, not just for her health, but also for the life she carries within. This is where the importance of pre-hospital management of obstetric emergencies comes into play. The first step in pre-hospital management is the identification of the onset and a detailed description of symptoms. Information about the pregnancy, such as the number of previous pregnancies or parity, gestational age, and any preceding complications, are also crucial. Let's say the emergency involves vaginal bleeding. The duration and severity of the bleeding are assessed. One way to quantify this is by the equivalent of pads used per hour. In cases where labor is suspected, signs such as regular contractions and a gush of vaginal fluid are looked for. Now, if the vaginal bleeding is less than 1 pad per hour, expectant management is commonly employed. This involves regular monitoring and reassessment of the woman's condition. However, if the woman is in her 3rd trimester and preterm labor is suspected, the management steps change slightly. The patient is typically placed on her left side, and fluid may be administered intravenously if there are concerns about potential blood loss or distress. In more severe cases, such as active labor, ongoing or severe vaginal bleeding, or increasing or severe abdominal pain, immediate transport to a hospital is necessary. In summary, pre-hospital management of obstetric emergencies involves identifying the nature and severity of the emergency, initiating appropriate immediate care, and deciding on the need for rapid transport. It's a critical process that can significantly influence the health outcomes of both the pregnant woman and her baby. Remember, a prompt and effective response is not just about reacting to the emergency at hand, but also about anticipating potential complications and taking steps to prevent them. And that, folks, is the true essence of pre-hospital management in obstetric emergencies.